Action.
In today's news, we have a story involving two UC nursing students from Mercy West Hospital who have found evidence for a better pain control method. We go live with Angie, who has all the juicy details on this topic.
The clinical issue we are addressing is pain control in the hospital and how it affects patient satisfaction. This is an important issue because it is important to make sure that patients are satisfied with their pain control while in the hospital. Our PICO question is, in patients at 4 Northwest at Mercy West, what is the effect of informing patients when pain medication is due by writing schedule on whiteboard in comparison to waiting for the patient to ask for the pain intervention treatment on patient satisfaction surveys?
To do some research on our PICO question, we searched the CIN-AHL database in the UC library. We used some keywords like pain management and patient satisfaction. To further narrow our results, we used eliminators that only pulled up articles with the English language between the years of 2010 and 2015, journal articles, articles of scholarly publication including peer review, and items with the full text online.
The first article we used is called Jordanian Patients' Satisfaction with Pain Management, used a descriptive cross-sectional method to examine pain experience in the sample population. A non-probability convenience sampling approach was used to obtain the sample population consisting of 375 inpatients from various Jordanian hospitals who were above 18 years of age. The researchers in this study concluded that the pattern of pain relief is more of a critical determinant of patient satisfaction than the pain severity itself. In other terms, this means that when a patient has an expected and sequenced method of receiving pain interventions, patient satisfaction surveys will be more sufficient.
Our second article, Effective Pain Management and Improvements in Patient Outcomes and Satisfaction, featured a qualitative study design that focused on quality improvement. The sample population used in the ND-NQI highlighted study of this article was very broad and was made up of patients from over 400 different hospitals who were experiencing pain. These patients were given questionnaires which determined patient experience scores related to pain management. The study concluded that daily pain rounds have been proven to be more successful in patient satisfaction and patient outcomes than interventions that depend on patients' requests for pain medication. The third and final article found to answer our PICO question was titled Quality Pain Management in the Hospital Setting from the Patient's Perspective. This study used a descriptive approach as well. Pain medication was mostly just given upon request without patient participation on decision making. Findings suggest that the patient should have a say on their pain management interventions and should have knowledge of when and how often they will receive the treatments. Findings also showed that patients have a higher satisfaction when less time was spent in severe pain. Overall, the level and quality of evidence presented is consistent with answering our PICO question. The evidence we found in these articles compared to current clinical practice is different in the sense that the evidence we found suggests that patients will be more satisfied with their pain control if they are on a set schedule of pain medication, whereas current clinical practice is to just wait for the patient to ask for pain medication.
Practice recommendations supported by our 3 articles suggest an indication for change in the current unit practice. Hospitals that wait for patients to request their pain management interventions generally have lower patient satisfaction scores in comparison to those that provide knowledge to their patients concerning their scheduled pain medication and how often they receive it. This method of pain management will lead to higher patient satisfaction scores and fewer unexpected tasks for the nurse. Patients will be more comfortable during their hospital stay, and everyone overall will just generally be happier.
And there you have it. You heard it here first from Channel 5 News.